Hi, my name is Stacey Pitts, and I'm the co-founder of CBD BioCare. And today I'm going to be interviewing Dr. Frank Michalski, who is a functional medicine physician and also a chiropractor in Buffalo, New York. And the reason we use Dr. Frank as our expert is because he has been using not only CBD products in his practice, but specifically CBD BioCare. So he's the best person to talk to and really understand how this amazing supplement can benefit people for a number of different conditions. So, hello, Dr. Frank.
Good afternoon, Stacey. How are you?
I am wonderful. And I'm excited about our topic today because this is one of the most common questions and perhaps one of the most difficult questions to answer. And it talks about serving sizes. We want to say doses. I want to say doses all the time because we talk about when we take a medication or a supplement, how much do we take, which is considered a dose of something, right? But I am not a physician, so I am not allowed to use the word dose. So for today's conversation, I will be referring to dose as a serving size. Now, Dr. Frank is a physician, so it coming from him, he can use that phrase or that word legally. So let's talk about that. I know we're going to talk about some of the legality and how we can refer to CBD, but let's first address what a serving size is, how much should somebody take, and I know that's a loaded question because what are they taking it for, right? Sleep or pain or cancer?
Yeah, of course. So I think the easiest, if anyone takes anything away from this, the easiest thing to say is there is no one size fits all. And it really is, you actually mentioned this before, it really is, to an extent, an experiment. We tell people to start slow and increase slowly until they find that sweet spot dose. But there has to be some guidelines, obviously, out there that exist because, well, what is slow? Is slow starting at 100 milligrams or is slow starting at 5 milligrams? So let's go over some of the most basic guidelines. And I can tell people, I pulled a lot of this information right out of the book, A Patient's Guide to Medicinal Cannabis. It's an excellent book if people want to get their hands on it. You can learn a lot. So one of the things that I liked about it was they gave some general guidelines in micro dosing. They gave one called the standard dose and then a macro dose as well too. So I'm going to read this to you guys directly. So they say micro doses, this is anywhere from 0.5 milligrams all the way up to 20 milligrams of CBD. And they recommend that for sleep, headache, PTSD, generalized anxiety, and some of the metabolic disorders. So again, that's 0.5 milligrams all the way up to 20 milligrams for those general disorders or symptoms. Now, when we talk about standard doses, this would be an increase of 10 milligrams of CBD upwards to 100 milligrams of CBD a day. This tends to get more into the specifics of things. So they reference Lyme disease, they reference depression, they reference arthritis, fibromyalgia, multiple sclerosis, they reference IBS, Crohn's disease. So this really would start to fall into that category of maybe more autoimmune diseases, something that's a little more complex than just your day-to-day symptoms of insomnia, stress, things along those lines. And again, that would be anywhere from 10 to 100 milligrams a day. Now, I'll say this as a disclaimer too. In my practice, I have very few individuals who are using more than, I would say, 150 milligrams a day. So I'd say as we move forward, it's rare that you're going to see someone in the macro dosing level in most cases. Now, when they do reference macro dosages, this is from 50 milligrams a day upwards of 800 milligrams plus. So you're almost talking a full bottle a day of the 1,000 milligram CBD oil. So these are very high dosages. And this is more reserved for patients who may be suffering with a cancer, people who may be suffering from epilepsy or a major seizure disorder, life-threatening conditions, very severe, very advanced conditions. Now, it's tough to say if someone says, well, I have diabetes or I have uncontrolled blood sugar, how much should I take? It's hard to say because everyone's going to be so different. Your blood sugar might be 180 and that's uncontrolled. But then we might have another individual who's pushing blood sugar levels in the high 200s. Both are uncontrolled, but one is far less controlled than the other one. What medications are they taking? Is one person on insulin versus one person being on metformin? It gets tricky, as you could imagine. So I tell most people, go ahead.
Before we move to that, you're on a really good path, and I don't want to interrupt too much,
Yeah.
but I do want to add something. On our website, we have a it says CBD oil servings, and it's a page on our website that can really help people, and it's a guide. It's basically the information you're saying, because we quoted right out of the book as well. But I want to make sure that people also understand. We mentioned micro, standard, and macro dosing. If you have a very serious condition and you believe in order to get results, you're in that macro area, I honestly believe, with my experience, believe that you could take a full spectrum CBD product that we offer in addition to a product with THC, so that you don't have to take so much of a full spectrum CBD product, because we remove the THC. Some of that THC can be very beneficial and reduce the amount of product that you need to take. So if you live in a state where it is legal and you are finding that you're taking a lot of product to get results, I would encourage you to look at THC, because there is a perfect balance when for some people that you need THC. The reason CBD is so popular is because I'm going out on a limb to say 98% of the time people can find relief with a full spectrum good product, full spectrum CBD product. But there are times, and if I had cancer, I would be taking THC as in addition to. So I just want to make sure that we point that out, that we're not telling you, if you have a chronic condition, to buy a bottle a day. I don't have anybody doing that, by the way,
No.
but we want you to know that if you feel that that's the amount that you would need, then sometimes supplementing with a THC product is the way to go. Would you agree?
100%. And actually, if you look at the literature, I think me and you were going back and forth on an email on this the other day in reference to literature out there available on cancer. You'll actually see that most of these advanced diseases, the studies that they're doing on them do involve a combination of CBD to THC, whether that's a 1-to-1 ratio or something greater. Yeah, very rarely do you see those macro. I don't know if I've actually ever seen someone in those macro dosages without THC. And
we do
of course,
have people that have, we do have some people that are using an extreme amount of the 3,500, for example, but they are also incorporating a THC product. So it's good to use in conjunction, because the reality is a THC product can make you high, right? And you've got to function, you have to live. So sometimes people take a CBD product, a high quality full spectrum CBD product during the day, and maybe take the THC supplement at night. So just wanted to make sure we were clear on that.
Yeah, that's a great point. I'm very glad you brought that up. We see the same thing here. A lot of people, we work with a few people with advanced MS, and that's exactly what you see. They're using THC at night, and they're using a small amount of THC. It's not anything over the top. Some of them even report that they barely feel anything from it, but I could not agree more with that. Absolutely.
And a lot of times, and we kind of experimented with this. We had people that were patients of a dispensary, and they were saying, I feel like I need more, but I don't want to get high. I already feel the effects of the THC. And a lot of them were senior citizens, to be honest with you. And one woman in particular that stands out in my head, she's like, I really feel it working, but I don't want to be stoned. Yep. And so I told her at the time, I said, I would recommend incorporating a full spectrum CBD into your regimen and see if that works. Well, it worked so unbelievably. I mean, I think the reason she stands out in my head is because she called me every week to tell me how fabulous it was working. So we repeated her story many times since then. And it has been the case for many, many people. So, it's about finding your perfect balance. And sometimes, as we're mentioning, it includes THC, but most of the time you don't need it. So Dr. Frank is going to continue to talk about how you can gauge what is the proper serving size for you and the condition, and how you can respond, because sometimes it's a headache and then you realize, well, maybe I'm taking too much. So we'll talk about that further.
Yeah, that's definitely a good point. So I'll just tell you exactly what we do in my offices. And this was just a combination of things, the demographic that we deal with. This is how we came up with this. But most people that I work with, we use the 1,000 milligram bottle. That's probably the most popular one that we use here in my offices. And I usually start people at half a dropper in the day. So half a dropper in the morning, and then maybe half a dropper in the evening too, depending on the individual. Most people, I'm actually going to say it's a half dropper in the morning, half dropper in the evening. I don't know, 85% of people are going to do well with that and not develop the headache, not develop an issue. And then we say, okay, do that for 4 days. So then after 4 days, I'll say, how do you feel? Did you sleep better? Did you notice less hot flashes? Did you notice a change in the headaches? Whatever symptoms we were going after, we asked them about. If they say, no, but I also didn't notice anything negative, I say, okay, great. Then we're going to advance you. So this is day number 4. We say, okay, you were doing a half dropper and a half dropper. We're going to now have you do a full dropper in the morning and a half dropper in the evening. Let's see how you do with that. At that point, most people usually start to see some results. If they don't, we go another 4 days. And as long as they say, hey, I didn't see anything negative, I didn't see anything per se positive yet, then we'll usually jump them up to a full dropper in the morning, a full dropper in the evening. If that's too much at once, you can obviously split that up throughout the day in a different way. That's just our approach. It's simple. Most people understand it. And we use that pretty much across the board, no matter what the condition is or what we're dealing with. And that works. Now, you mentioned earlier, what I find is, because for some people, my initial recommendation of half in the morning, half in the evening is too much for them. They'll usually report that they got a dull headache, and that just seems to be a telltale sign that I've seen over and over, where I actually experienced that the first time I used it. I didn't really understand a lot about it going back, 2-3 years ago, but nonetheless, if they do experience that, I tell them, great, you know what? That means it had an impact on your body. We know it's going to do something for you. We just started off with a little too much, so let's cut back. And then for that individual, we just go the opposite direction. Instead of increasing, we're decreasing. And usually somewhere along the path of either increasing or decreasing. And as I mentioned, we stay at a dose for about 4 days. We eventually find that quote unquote sweet spot. And it's just so different across the board. If you listen to our other podcasts, you might think someone who's bigger or has more body mass might require more. Well, that's not true, because if they're a female and they're in menopause, well, maybe they require more than a female who's tinier and not in menopause. So you really do have to experiment. The medications you take, the foods you eat, your lifestyle, it all plays a role. And then one of the biggest and trickiest parts to all this is that everyone metabolizes CBD differently. Your endocannabinoid system is different from mine, and it's different than someone else's. So the best example I could use that people could probably have heard a story about, why is it that if one person were to use a THC containing product, they feel relaxed, and another person feels paranoid? Everyone's endocannabinoid system is different. CBD is no different, except we're lucky with CBD, you're probably not going to have those negative side effects that could potentially occur with THC. But that's really how we do it.
And something that I think is important to note for our viewers is that you're seeing people who are in pain, right? They're coming to you because they are having pain, they are having some sort of issue. We see people that take CBD for sleep, for a headache, for stress and anxiety, for tremors, for a lot of other ailments, and they can take a lot less. So someone for stress and anxiety, we've noticed that the amount that people take is really pretty small. The same is true for tremors. So it's one of those things, right? When you have something more severe like pain, you tend to take a little bit more than you would for stress, anxiety, sleep, something along those lines.
Yeah, I couldn't agree more. Yeah, I think of one gentleman I had in particular early on when we had just got involved with your company and working with you guys. And he was a larger gentleman, really high up in a company, very intense job that he had. And he was having issues with panic attacks and bad ones. And his meds just weren't cutting it. He really couldn't get control of things. And I said, okay, this is a bigger guy. He's older. We're going to go a more aggressive amount. called me the next day. He was like, I didn't feel good. I didn't feel bad. He's like, something wasn't right though. And I'm like, okay, let's try more. More didn't work. Then he told me, he's like, look, I was exhausted. He's like, I don't know what that was, but he was hopeful. He was like, okay, it did something. He was like, I was definitely calm, but I was tired. This gentleman wound up taking 2 drops underneath his tongue a day. 2 tiny drops is what we wound up eventually reversing it to. And that did it for him. At 2 drops a day underneath his tongue of 1,000 milligrams concentration, it worked.
I always tell people, I don't sell it. If somebody says to me, this is never going to work for me, I always say, you're right. Probably not a match for you. Yeah. I'm not going to go there because they've already made up their mind. And that's going to be somebody who uses it twice and says it doesn't work and returns it. So it's not a product that I sell. We have a 60% repeat customers. 60% of our customers are repeat. The other 40% are new customers. So it's amazing how well these products really do work. And we just consider ourselves the messenger.
Yeah, that's all we do here too. It's really the same type of idea. Here's the education on it. Here's where we recommend you start, and let's see what happens from there. And most people, really, really great things happen.
Absolutely. So let's talk about another very common question, and that is, are there any negative side effects from cannabis or our CBD products? And then the other one is, are there any drug interactions? Anything I have to worry about?
Yeah, so this was a fun topic. We were really involved on our forums earlier on the week diving into this, and it's something that's exciting and needs more explanation. So with that being said, when we're talking about the CBD BioCare products, no, and you can go right and again, look at the government patent. They put on there CBD does not have overdose potential. It does not have the addiction potential. So we don't have to worry about those 2 things that we have to worry about with a lot of medications that are used for pain and anxiety and depression. So that's great right off the bat. The most common side effect I've ever seen was just that dull headache. And even that's rare. And it's been a simple fix for us. We just cut back the dosage. That's the main thing I've seen. Maybe once or twice we had someone say it gave them a little stomach upset, but it's hard to predict. Maybe they ate something that day, but same deal. Okay, let's cut back the dosage a little bit and see if you feel better. So no, right off the bat with CBD, there does not appear at the time in the literature, according to the patents, to be any major side effects. And I think it's going to continue to go that route well into the future. Now, when it comes to medication interactions, and you'll see this on any website, you'll see this everywhere, they talk about, it interacts with this enzyme in your liver called CYP450. So let me just explain real briefly how we got to that conclusion that it interacts with that enzyme. So there was a trial done in 2014. GW Pharmaceuticals looked at their product, which they have a prescription CBD low-level THC spray, and they noticed that, hey, they prescribed the spray, and then they did a test with a drug that speeds up the activity of CYP450 liver enzyme and one that slows it down. And I'll tell you exactly what the study said, because it's important to understand this to an exact, because it's in defense of CBD and really how minimal the chances of these reactions are. So they did a systematic review in 2014, and they concluded that CBD generally has a low risk of clinically significant drug interactions. A few studies in current review included examination of drug interactions with CBD, specifically GW Pharmaceuticals, and their CBD THC spray. They used a CP450 inducer, a CP450 inhibitor, and this is what they concluded overall, that CBD in combination with these drugs are well tolerated, but consideration should be noted when co-administration with other drugs using this pathway is given. So they basically concluded this. In most cases, it's going to be safe, even when we're using drugs that would be considered to have severe interactions. Now, someone else brought up a great point actually earlier in the week on our forums, and they said, well, wait a second, what about taking it sublingually versus orally? Is sublingual going to have as much interaction as, say, a capsule or a food or an edible? And it turns out that was a fantastic question. No, when you take something orally, that supplement, that medication, whatever it is, it has to go through your lower GI tract, and then it goes right to your liver where that metabolism of that supplement or drug occurs. When you take it sublingually under the tongue, like our droppers, it goes directly into your bloodstream. It doesn't go from your gut to your liver. It goes directly into circulation. And then once it's already been in circulation and been absorbed, some of the leftovers will then pass through the liver. So yeah, the chances are much less likely of having an issue with a sublingual than if you were to have, a mega dose of an oral serving or an edible or something along those lines. So I thought that was important to know. Another thing that's important to understand too is, these medication interactions appear to be so minimal, and most of them are done on CBD isolate. There's a lot of literature out there arguing that when you're taking a full spectrum product like we have, the terpenes in it, all these other components in the cannabis plant actually seem to work synergistically with a lot of medications as compared to working against them. So I think it's important to know too, most of the things studied when it comes to these interactions are on CBD isolates, not on full spectrum products. And the interaction of full spectrum is hypothesized to be even less. The only ones where I really, and this is again how we run stuff in my office, where we really have a concern is if someone's going through chemotherapy, I mean, they should just watch everything they're putting in their body. Again, there's a lot of people using CBD in conjunction with chemotherapy. Roswell Cancer Centers right here in Buffalo is starting to do a lot with it because of the benefits. So most of the time, probably not an issue. You just want to make your oncologist aware. Hey, listen, this is what's going on. Most of them are on board and willing to have that conversation. Seizure medications, same type of deal. You'd want to make your physician aware. Those are really the big ones. And then there's been some stuff saying the anti-anxiety medications, benzodiazepines. It's also important to note this, where they're seeing the interactions, we're talking a serving size or a dosage well in excess of 100 milligrams a day. Mostly everything that you're seeing, if you're somewhere between 5 and let's say 40, 50 milligrams a day, extremely unlikely. So just some things are for people to understand. The current literature out there is based on pharmaceutical drugs that are mostly isolates. And again, like I said, the interactions are probably minimal at the most.
That's a really good point. And the bottom line is we are speaking generally. If you are taking medications, if you are working with a physician, it's very important that you talk to them and let them guide you through this process. But generally speaking, full spectrum CBD products are extremely safe. I always liken it to aloe vera. I mean, you're not concerned about aloe or you're not concerned about orange juice, products that come from nature. Now, can you have a negative reaction to aloe? Yes, if you're allergic, you will have a negative reaction. The same is true with orange juice, right? So this is just another plant. And so you could have an allergy to the hemp plant. That absolutely could be probable. Highly unlikely, but it could happen. But regardless, we're speaking generally in terms of, how much you should take. But what I really want people to walk away with is there are very few, if any, drug interactions that are known. Research is somewhat limited, but is being done at a really rapid pace compared to where it was 3 years ago.
Big time.
You're not going to overdose. You could drink the whole bottle and nothing's going to happen. Your dog could drink the whole bottle and nothing's going to happen. You might have a little bit of an upset stomach, but nothing else, right?
Yeah.
So it's a safe product, and the benefits seem to outweigh any negative, which to your point is why an oncologist is okay letting their patient that is on chemo take a product such as ours.
And that's the whole thing. Once you kind of realize from a physician standpoint, okay, do no harm, at that point, you're inclined to say, yeah, go for this. This looks like the benefits are going to outweigh any risk, if any at all. So why would you not go for it? And that's where you're seeing most physicians go. I think more often than not, I see, I don't know if I've ever had a physician, someone here, tell their patient not to take it. More often than not, this is what I hear. CBD, I don't know anything about it. And that's it. They just leave the person in the dark with it. So that's really, you have to educate yourself. I tell people how many medications, do people know caffeine interacts with about 86 plus medications on the market? Have you ever thought while you're taking your medication in the morning, oh, I'm drinking coffee? It's the same type of thing we're talking about here. Probably not a big deal. But I do tell people, listen, it's your responsibility. Ask your pharmacist about side effects. If you feel like something's happening, you should know what you're taking, right? We see it often with statin drugs. People come in with pain in their legs that they think is coming from their back, and it's a myalgia from a statin drug, and they're having a bad reaction. So just know your reactions to your medications. Understand what you're taking. People ask us a million questions about CBD, but they'll take any other number of things without even hesitating. So just know what you're putting in your body. And at the end of the day, you probably don't have to worry too much about it. The more educated you are, the better off you're going to be.
Very well said. I think that's a perfect way to end that. Thank you so much for the information.
Of course.